here representing Nina Messina from UCLA, who has fallen ill. But Nina and I have worked together for many years, and we both are passionate about defending girls' rights, women's rights, and trying to figure out what's going on with girls and women in substance abuse and in the criminal justice system. We're working very closely with Kathy and Nina and the Lloyd Society. In your packet, you'll see an orange brochure. This is information on our organization, because I don't have any on the website. But on here, you can find information, or you can ask me later if you have any questions. So I am here, as I said, representing Nina and representing girls in the criminal justice system, and advocating for more work that needs to be done in terms of programming and research and theoretical work for better understanding issues of girls in the criminal justice system. And we know that girls and boys are different. They enter the system differently. Their involvement in crime is different. Our psychological processes are different, and so our needs are always also very complex and different. And so, of course, this impacts the development of interventions and programming that's needed, and especially in a system that was originally designed for boys. So this is one of the things that I want to look at today with you. What are the differences between girls and boys, and particularly the issues of childhood trauma, which are very, very significant. Other people have mentioned this in the history of girls who are in the criminal justice system. We're seeing a rapid increase of girls in juvenile justice system as well. So we're trying to keep up in terms of the research and programming for girls. These are some of the differences between girls and boys. We're seeing that girls are very similar. Girls in the juvenile justice system are very similar to women in the adult criminal justice system. So girls tend to be arrested for more minor offenses than boys. Many are status offenders, such as running away or truancy. Very high rates of physical and sexual abuse amongst the girls. And multiple physical and mental health needs, a lot of self-inflicted violence, such as burning and cutting, which we see more in girls than in boys. Eating disorders and suicidal ideation, also very high rates. Girls may also be pregnant or dealing with parenting issues when they're going through this whole system, which adds another very complicated layer. In terms of similarities to boys, girls also come from fairly dysfunctional households like boys. So a lot of domestic violence and a lot of drug use in the families. The girls are also very racially and culturally diverse like the boys, and they have struggled academically or have even dropped out of school. Now, the good news here in the very bottom is that girls are very resilient. So there is hope for helping girls through the system. Some retrospective analyses of women in prison have been done, and they show that 60 to 90% of female prisoners have reported histories of trauma and abuse in their childhood. Now, this can be sexual or physical harm by somebody they know, by a stranger, or emotional abuse and neglect. These are very high numbers. The risk of physical abuse for women and girls continues throughout the lifespan. So when boys and girls are younger, the rates are more similar and the risks, but as the girls get older, the abuse continues. And this is tied to the fact that the abuse for women is a lot of times tied to their interpersonal relationships. So we see this throughout the lifespan. The girls in juvenile justice system, in terms of the literature, report 70 to 90% rates of history of victimization. So this can be sexual, physical, or emotional abuse. This is very important because this exposure to abuse, Messina and Grella at UCLA found, is tied to when girls enter the crime scene and drug use. So the more abuse, the younger the girls are when they enter. They also tend to begin criminal activity younger than boys, and it escalates faster. So for example, girls with low levels of abuse enter drugs and crime at ages 20 to 25, but girls with high levels of abuse enter at ages 15 to 20. So this is an opportunity for prevention as well. That's the high and the low in terms of abuse. All right, so the issue with these high levels of childhood trauma impact a lot of other issues once we get the girls in the system. Somebody had already mentioned this, very high levels of poor mental and physical health amongst the girls. The histories of childhood trauma are tied to personality disorders, depression, PTSD, panic disorders, and eating disorders. In addition, we see a lot of physical problems: anemia, hepatitis, toxemia, hypertension, diabetes, and asthma, gynecological problems, eating disorders, and substance abuse disorders. So programming for girls has to address a lot of these issues. In terms of theoretical models, the relational model starts to address these differences between men and women. So this is one of the models that is being used more for programming for women. Now, in gender responsive approaches, which are part of relational models, you start to look at, what are the needs and the strengths of women compared to men. And in trauma-informed services, which are also part of the relational model, you start to incorporate the issues of trauma. Now, one issue is that there are no evidence-based programs for girls in juvenile justice. So there's a lot of work to be done in this area. We think that services that address girls-specific needs could increase retention, long-term outcomes, and have cost benefits. Now, the literature is mixed about having gender-specific approaches. Some of the literature shows that mixed treatment has the same effects. Some shows that male treatments actually have negative effects or have the same effects for girls. So we don't know yet. We do think, though, that based on the work that Nina has done, that gender-responsive approaches are the way to go with girls. Some key recommendations which have already been mentioned. The interagency collaborations are key. All of the different agencies working individually are not really going to help us move the girls along. So social service partners, child protective services, juvenile justice system, and community partners should be working together. We should be looking at some early prevention and intervention opportunities because the issues of trauma are affecting the course of the girls so significantly. Looking at gender-responsive trauma-informed services, and of course, collaboration with research institutions. Thank you.